Do you have hypothyroidism, where your thyroid isn't doing its job with hormones? Or maybe you've had your thyroid removed, had surgery, and now you need to take this medicine, levothyroxine. In this video, I'll lay down 10 tips, 10 must-know things about your thyroid hormone. I'll tell you about food, symptoms that stick around even after treatment, and I'll chat about test day, like should you take your medicine before or after your blood's drawn? Can you split the pill? How long till you can grab a bite to eat? All this stuff I'll unfold in this video. Since it's 10 tips, let's aim for 10,000 likes. That way you're spreading the video around. I always talk about this stuff during appointments, and a lot of people don't know, have no clue, but these things can majorly impact your treatment. If you're missing some info and end up popping a too high or too low dose of your meds, you could have symptoms because you're not clued in on this stuff I'll discuss in the video. So, what are the 10 tips? Number 1, don't break levothyroxine, the thyroid hormone, because the pill is coated. It's meant to be absorbed in your small intestine after the stomach. And if you break it, stomach acid can mess with the absorption. So for example, if your daily dose is 50 micrograms, it doesn't help to buy the 101, maybe because it's cheaper or because they only had the 101, and break it because you'll end up with 2 halves of 50, but your body, the stomach and the intestine aren't going to absorb the pill right the way it's meant to be absorbed. So you should combine instead. Like for that 50 example, you could buy 2 of the 25 instead to get 50, but don't split a bigger pill. Got it? Number 2, can someone with hypothyroidism eat broccoli or cauliflower? Yes, definitely. There's no issue. No human studies show that broccoli or cauliflower are bad for the thyroid. This is a myth doing the rounds online because there was a study on rats where the rats were fed only broccoli or cauliflower, and those rats developed what's called goiter, where the thyroid gets big, and they also had hormone problems. But this doesn't happen in humans, so feel free to enjoy broccoli or cauliflower if you like, because it's not going to worsen a thyroid problem or interfere with the action of levothyroxine, the thyroid hormone. No worries at all. That's why this myth exists. But as a thyroid specialist, I'm letting you know it won't cause you problems. Number 3, a common question is about symptoms. Will the symptoms go away? First off, what are the symptoms? Hair loss, brittle nails, constipation, puffiness, very characteristic. In medical speak, we call this edema. This edema, this puffiness, can show up in your legs and elsewhere in your body, like swelling in your face. Changes in your heartbeat. You might have bradycardia, when your heart beats slower than 60 times per minute. Other stuff like dry skin, feeling wiped out, another typical symptom of hypothyroidism. And the good news is, after treatment, when the dose is stabilized in your blood, these symptoms should fade away. If they don't vanish, the doctor should look for other causes leading to similar or even the same symptoms. This can be confusing in the real world, but symptoms should disappear. Number 4, and super important, iron deficiency and low ferritin levels, which are your iron reserves. Because iron is super important for the thyroid hormone to function properly. Every week I have patients who are all stressed out. Even though they're receiving treatments, they still have symptoms. They often think, or have heard someone on the internet say, that it might be because of a deficiency in an enzyme that changes T4 into T3. But let me tell you, this is a super rare deficiency. And when I run tests, when I examine them, more often than not, they don't have an enzyme deficiency. They're actually just running low on iron, or their ferritin levels are super low. There are other deficiencies like a lack of selenium and zinc. They're not as common, but they're possible. There can also be other diseases tied to hypothyroidism, like celiac disease, for example. Since celiac disease, or gluten intolerance, is an autoimmune disease, and hypothyroidism is often caused by another autoimmune disease known as Hashimoto's disease. There's a link between the two, but not every person with hypothyroidism will struggle with gluten. Heck, less than 5% do. But since hypothyroidism is super common, affecting millions of people, it's common to also find it in tandem with celiac disease or other autoimmune disorders. Now, number 5, on the day you have your blood test, should you take your medication before or after? You should take it after the blood is drawn. If you take it before, it might mess with some results, like the one for free T4, okay? So what I suggest is you take your meds with you to the lab, get your blood drawn, then take the medication. Moving on to number 6, this pointer can really make a difference in your treatment. Since thyroid tests involve hormones, it can take some time for changes in the thyroid to show up in lab tests. It's not like a blood sugar test where you can see changes rapidly if you take a medication for diabetes, something like insulin. With thyroid tests, it can take anything between 6 to 8 weeks before we can accurately assess the dosage. So, if the doctor adjusted the dose, ideally, you should wait at least 6 weeks before you test again, unless your doctor specifically instructs you to test again sooner. Otherwise, to get a reliable result, wait about 6 weeks. It's a very crucial tip because I get it. When the doc alters the dosage, you want to know the results pronto, and 6 to 8 weeks can feel like forever. I'm making this video to tell you to relax. If you test too early, it can cause more harm than good. We might misinterpret the results.
adjust the dose again, which could really upset your health balance. Now on to number 7, should you switch brands? One month you choose levothyroxine produced by one lab, the next month you switch to another lab. Is it a good or a bad thing? Not a good idea. You should avoid switching brands. Now I'm not endorsing any lab or brand, but it's crucial to remember that even if the label says levothyroxine 100 micrograms, for example, the active ingredient and concentration might not be exactly the same, thanks to something we call bioequivalence and bioavailability factors. So, if you're taking it from one lab, stick with it unless your doctor tells you to switch. Opt for buying from the same lab because sometimes there's a difference. Sometimes 100 can be 95, and from the other one it might be equivalent to 105, for example. So, there is this variation allowed by law. This is across the world, not just in the United States, or simply in the United Kingdom or Brazil. But many countries have this regulation, So, that's why even though it's the same thing, you should avoid switching brands. Number 8, if you forget to take your thyroxine, another really important tip. Just good tips here. If you are liking what you're hearing so far, then subscribe to the channel. If you're already subscribed, make sure the bell notification is on. Click on the bell and select all the options. That way, whenever I post, YouTube will notify you, send you a notification so you can keep up with the new videos. But then, if you forget to take your pill, what should you do? If it's during the day, you're going to fast for an hour. Take your thyroxine pill and wait another 2 hours before the next meal. If you remember, the next day you're not going to take 2 pills, you're going to follow the prescription as usual, but make sure to note down that you forgot to take it that day, which is very important, because imagine you forgot 3 days in the month, you might be thinking like, but it's only 3 days. There are 30 days in a month. If I forget 3 days, it won't make any difference. This is completely wrong, because that corresponds to 10% of the total dose. This can make a difference in your blood test. It can make a difference in your symptoms. So it's crucial that you note if you forget to take the dose so the doctor is aware. Otherwise, it can cause a huge mistake. The doctor might look at the test assuming you're taking 100% of the dose, make a change, and then it's going to mess things up. Like what happens with many people. One time the test is really high, another time it's really low. So make a note. Whenever you forget, make a note. Number 9, your body doesn't get resistant to levothyroxine. Popping a pill won't cause your body to build up tolerance and forcing you to up the dose. No way. That's a myth. What usually happens is, often when the doc diagnoses, the patient is at the earliest stage of the disease, and Hashimoto thyroiditis, it's like an autoimmune disease. Over time, with proper follow-up, many times, depending on diagnosis stage, the patient might need a higher dose because the thyroid is on the fritz, but it's not that the thyroid med is messing with the thyroid gland. It's not that. The disease is just doing its thing, damaging the gland, the thyroid. It's not that. The disease just carries on its ruthless journey, moving forward, making the thyroid stop producing enough hormone. So, no stress about that. There's a lot of talk that thyroid meds could trigger other diseases, even the thyroid itself. Folks who need the hormone, those with hypothyroidism, no worries. The meds don't do that. But if you don't have hypothyroidism and take the thyroid hormone, what's going to happen? The thyroid will get lazy, your body will figure it doesn't have to produce anymore. So, in a way, that part is true. If you don't need the hormone, some folks take the thyroid hormone to lose weight, which is totally not okay. What will happen, apart from an increase in arterial fibrillation, a type of arrhythmia, and also osteopathy bone changes, the thyroid may get lazy. But if you truly need it, don't sweat about this, alright? Number 10, thyroid and pregnancy. Levothyroxine is safe during pregnancy. There are a bunch of studies vouching for the benefits of hypothyroid pregnant women taking levothyroxine. If you're under control, your pregnancy doesn't come with risks. In fact, studies show that treating hypothyroidism during pregnancy has benefits. So, no need to worry, it's a well-studied and safe medication. On a scale of 0 to 10, how would you rate this video? If 10, I'll make more like this. Tell me in the comments, where in the world are you tuning in from? I'm here in Porto Alegre. How about you? Now, I've got a video suggestion for you to watch. It's about fatty liver disease. Do you know what are the best and worst foods? Those foods you should nix from your diet if you have a fatty liver? Go on, watch this video. You'll find it useful. Catch you later. Until next time.